So I think you've heard from a number of our presenters, both yesterday and today, that colorectal surgery can be a risky business and fraught with high complication rates. And so we wanted to finish up and touch on something called E.R.A.S, which has gained a lot of momentum in recent years, which is something that can potentially decrease some of those issues. So how big a deal is E.R.A.S? No disclosures relevant to this. We'll go through a couple different areas. So as enhanced recovery has evolved, it's gone through several name changes. It's been called enhanced recovery after surgery, enhanced recovery protocols, fast track protocols. The term fast track is a little bit shied away from now because it tends to imply that we're pushing patients along faster than maybe we should, which is certainly not the case, but enhanced recovery is kind of the overarching theme throughout all of these protocols. And so this idea developed, and it's really a way to minimize the physiologic impact that we do to our patients. So if you look at the way old surgical dogma has been, we take patients that are going to have major surgery, we tell them you have to be NPO after midnight for your 3 p.m. case the following day. Surgery is kind of like running a marathon. If you're going to run a marathon, you wouldn't fast the day before. You would make sure that you have all the adequate carbohydrate stores that you need to undergo the stress of surgery. And so enhanced recovery is a way to deal with that and minimize some of those physiologic impacts that surgery can have. But exactly how much of an impact is actually surprising. So if you take nothing away from what enhanced recovery can do, remember this slide. So if you did everything you've done previously, the only difference is you do an enhanced recovery, which we'll talk about what components of that are. This is the kind of results you can expect to see. You can cut your length of stay by as much as 2.5 days, and you can cut your 30-day morbidity in half just by doing enhanced recovery protocols. That's a pretty profound statement on the impact that these things can have. And if you look at it another way, for every 4.5 patients, you can avoid 1 complication. This same study looked at the rate of complications in colorectal surgery, and so nationally, colorectal procedures represent only about 10% of all surgeries done. Yet we own 25% of all complications. So it's particularly important if there's something we can do to decrease that, we should do it. Also, the impact of each complication can be fairly profound. You've seen some of the cost data that we presented this morning, and in an era of pay for performance, these are going to become more and more important. So the study showed that each complication you have after surgery can impact your length of stay by as much as almost 10 days. And each complication that you have, cut ureter,